The senator from Tennessee.
As if in legislative session and notwithstanding Rule 22, I ask unanimous consent that the Committee on Health, Education, Labor, and Pensions be discharged and the Senate proceed to the immediate consideration of S 4329. Further, I ask unanimous consent that the bill be considered read a third time and passed, and that the motions to reconsider be considered made and laid upon the table.
Is there objection?
Mr. President,
The senator from Wisconsin.
reserving the right to object. Mr. President, 4 years ago today, women in America lost the right to control their own bodies when an activist Supreme Court overturned Roe v. Wade. For 18 months, women in Wisconsin were forced to live under a law passed in 1849, widely viewed as a criminal abortion ban. Overturning Roe was just the beginning of the Republicans' war on women's reproductive rights. This bill is yet another example of their agenda to make it harder for women to access care by stripping away funding for family planning clinics. Title X clinics serve millions of Americans and offer cancer screenings, birth control, and wellness exams. Republicans have already tried to rip this health care away. Their big ugly bill last year defunded Planned Parenthood, leading to the closure of 60 clinics so far. And we expect that as a result of the big ugly bill, in total, over 200 clinics will ultimately close. That's 200 fewer places that women can get essential health care, exacerbating an already dire health care crisis that families are facing. This administration has also withheld funding from Title X clinics for months, threatening access to care for more than 800,000 people. They then delayed funding for the program again, causing even more confusion. The administration's goals are clear. They want to sow chaos and end access to reproductive health care. And there's no reason that we, the people's branch, should be adding to that and further making life harder for the people we work for. We should be focused on expanding access to health care and lowering the cost of it, not closing more clinics, jacking up costs, and eroding women's rights even further. I will not stop fighting until every woman in this country has the freedom to make her own choices about her own body. And therefore, I object.
The objection's heard.
Mr. President.
The senator from Tennessee.
You know, it is always so interesting to me to hear the objections of my colleagues when it comes to something that is considered a pro-life measure. And pushing this bill forward and listening to my colleague, it just shows me that once again, they are not standing with that right to life. We're celebrating 250 years of our great nation. What do we have? That right to life, liberty, pursuit of happiness. And today marks 4 years since the Supreme Court corrected a blatant act of judicial activism that legitimized the killing of more than 63 million unborn children. Now, as my colleagues across the aisle like to say, oh, but abortion is compassionate. Think about these 63 million unborn babies. 63 million. So yes, 4 years ago, the Supreme Court corrected this act of judicial activism. With the court's Dobbs decision, authority finally returned to the states and we the people where it belongs. This marked a watershed moment in the fight for life, but there is still so much more work to do to make certain that that right is recognized, that right to life, the right to life, to liberty, to the pursuit of happiness. Now, we know that one thing that needs to be done is ending all federal funding of abortion services. That is important. This isn't about closing clinics. This is about making certain that taxpayer money does not go to fund those services. For decades, federal law has prohibited the use of federal funds for abortions. But big abortion providers like Planned Parenthood exploit every loophole possible to get around this restriction. It is a long list. They're addicted to your money to provide abortion services. Now, one of those loopholes is the Title X Family Planning Program. This program is intended to assist low-income women with family planning services. Section 1008 of the Public Health Service Act explicitly states that Title X funds, and I quote, shall not be used in programs where abortion is a method of family planning, end quote. That is the law. This isn't about restricting health care. It's about we need to support life, and we need to abide by the law. Yet under the law, Title X clinics are allowed to refer patients for abortion and share facilities with abortion providers. As a result, Planned Parenthood clinics that receive federal family planning funds can share the same facility, staff, and waiting room as an abortion clinic. There's no division there. They're sharing that space. They are sharing staff. They are sharing the waiting room. You go in the same door, Mr. President, and they are thereby using taxpayer dollars. Now, taxpayers, including millions across the country who hold deeply held beliefs opposing abortion, should not have to spend a penny supporting abortion providers. This is their hard-earned money. We have a law. The law should be abided by. That's why I am asking for that we move forward with this bill. We have heard my colleague's objection. I disagree with her. We should abide by the rule of law. We should support that right to life, and I think everyone should stand up and close this loophole once and for all. I yield.
Today is the 4th anniversary of the Dobbs decision overturning Roe v. Wade. And I just shared some reflections about what happened in my home state of Wisconsin when we reverted to a law that was passed in 1849, 1 year after Wisconsin's statehood, that was widely viewed as a criminal abortion ban, and no abortion care was provided within my state until a court ultimately ruled many months later that that 1849 statute did not apply. But in the meantime, I heard stories from Wisconsin women whose lives were upended by the Dobbs ruling. When I think about one of the first stories I heard in those first months after the Dobbs decision came down, I remember a woman sharing with me that she was pregnant, expecting, delighted about that, when her water broke at 17 weeks. She went to her doctor and the hospital where she was planning to deliver her baby. And they said, your baby has no chance of survival. But they said, we can't do anything to assist you in this moment because Roe v. Wade had been overturned. The doctors consulted lawyers. We had lawyers actually practicing medicine, if you will, in the state of Wisconsin at that time. And she was sent home. They said, let nature take its course. Well, in her case, that meant facing sepsis and a fever that got worse and worse and worse. How close do you have to be to death before you can get the health care that you need when Roe v. Wade is no longer the law of the land? What it drove people in Wisconsin to have to do is to consider getting care out of state. And so today I rise in support of the women across this country who just want to be able to control their own bodies. Right now, 27 million women are living under abortion bans since the overturning of Roe v. Wade. And it's no secret that my Republican colleagues want to see a national abortion ban enacted piece by piece. Because of these bans, women are literally bleeding out in parking lots outside clinics and hospitals. Women are developing life-threatening infections like the one I just described from my constituent in Wisconsin. Women are being told that they have pregnancies that are not viable, but that they have no option for health care. Women are being denied the care that they need. Even in states like Wisconsin, where, because of our courts striking down the 1849 statute that was in existence when the Dobbs decision came out, abortion is now legal, though many restrictions remain on the books. Women face access issues. They face barriers to accessing the health care they need. In Wisconsin, abortion services are only available in 3 out of our 72 counties. That leaves 69 counties without care, meaning the people who live there must have to travel for the care they need. They have to arrange child care and take time off work, sometimes drive for hours, and they have to face unnecessary barriers just to get the health care that they need. That's why I introduced the Reproductive Health Care Travel Fund Act. This legislation would help ease the financial burdens that too many women face when they're trying to access safe and legal reproductive health care, oftentimes far away from their homes and their support system. This bill would get women the practical support they need to access care, including support for travel, childcare, lodging, meals, and more. I won't stop fighting until a woman's right to choose is fully restored. But in the meantime, the least we can do is help women access the care they need that the Supreme Court and some of my Republican colleagues continue to put further out of reach for women. And I urge my colleagues to address the healthcare crisis we are facing in this country by reducing the barriers that women face to get the health care they need. So therefore, as if in legislative session, I ask unanimous consent that the Senate proceed to the immediate consideration of S. 4922, introduced earlier today. Further, that the bill be considered read 3 times and passed, and that the motion to reconsider be considered made and laid upon the table.
Is there objection?
I object.
The objection is heard.
Mr. President, now we just talked about the Title X Abortion Provider Prohibition Act, which would ensure that taxpayer funds aren't used, these family planning funds don't flow to abortion providers. Now, what Senator Baldwin has talked about in this bill is the Reproductive Health Travel Fund Act. And what it would do is make obtaining abortions easier. It'd make it easier because it would allow them to be paid for by tax dollars. So let's let this sink in for a minute. This bill would authorize hundreds of millions of taxpayer dollars to fund, as my colleague said, the travel, the lodging, the meals, the child care, and all the other expenses that are associated with obtaining an abortion. 4 years after Dobbs rightfully returned this issue to the American people and their elected representatives, this very legislation would undermine that decision by using federal dollars to facilitate and fund abortions across state lines. Now, we all want healthy moms and healthy babies. That is a goal that everyone shares. But instead of supporting pregnant women by making grants available to pregnancy resource centers, our colleagues across the aisle would rather spend that $350 million in taxpayer funding each year to eliminate what makes obtaining an abortion inconvenient. That is absolutely atrocious. Democrats claim to be the party of choice, but bankrolling the entire abortion process only increases the pressure on women to choose abortion by making it the more financially feasible option. There is no choice in that. A 2004 study found 64% of women felt pressured by others to have an abortion. If Congress truly wants to respect the conscience rights of millions of Americans and actually protect women, children, and families, it should reject this legislation and pass the Title X Abortion Provider Protection Act. For all of these reasons, I object.
The objection is heard.
President.
The senator from Mississippi.
Mr. President, 4 years ago today, our nation took a historic step when the U.S. Supreme Court's Dobbs decision overturned the so-called right to end a baby's life in America and returned the authority to regulate abortion to the people. Since then, the abortion industry has intensified its efforts to convince women that pregnancy is inherently dangerous and harmful to their health. While pregnancy can involve complications, those cases are the exception. They are not the rule. Yet these exceptions are often used to justify abortion at every stage of a pregnancy, including the growing number of at-home abortions using mail-ordered mifepristone without direct physician oversight. Here's the truth about chemical abortion. First of all, this regimen is not safer than Tylenol. A woman can experience anywhere from a month to 6 weeks of bleeding after taking the abortion pill regimen, horrendous bleeding that is significantly heavier than usual and is especially dangerous for women who are already anemic with low blood counts. Nearly 1 in 9 women who take these drugs will suffer a serious adverse event such as sepsis, hemorrhage, infection, or emergency surgery within 45 days of ingesting the pill. Chemical abortion can also pose a serious threat to women's future fertility or even their lives when they are not screened through an in-person doctor visit for conditions like an ectopic pregnancy. And a woman who has a chemical abortion has 300% increase of preterm birth in future pregnancies, 300% increase. The Save Moms and Babies Act puts common sense safety protections back into place by at least requiring an in-person doctor visit before being prescribed mifepristone that is designed to abort a baby. This drug should never be administered through the mail, where abusers and traffickers can hide behind a computer anonymously. While I cannot stress enough the importance of correcting misinformation about abortion drugs and reinstating safety protections that the Biden administration recklessly removed, we also need to flip the abortion industry's entire script by highlighting something too often overlooked: the extraordinary benefits of pregnancy for women. Pregnancy is nothing short of remarkable when you consider everything that must fall into place perfectly to conceive, sustain, and deliver a healthy child. While the process can feel overwhelming, women's bodies are uniquely equipped for this life-giving role. The resilience and strength demonstrated through pregnancy and childbirth are incredible and empowering. For example, pregnancy is often described as a marathon, and for good reason. A woman's cardiovascular strength expands when her pregnancy is carried to full term, and her risk of cardiovascular disease and stroke are significantly reduced later in life. From the long-term well-being that motherhood can inspire, with a commitment to healthier habits, to protective effects of breastfeeding associated with the reduced risk of breast cancer, these changes offer life-sustaining gifts. In fact, research suggests that women who have children later in life often experience greater longevity. Women's bodies were seemingly designed to break the limits and then keep going. As we continue to build a life-affirming society in this Dobbs era, our ongoing challenge is to continue championing the physical, mental, and emotional benefits of pregnancy and of motherhood. As if legislation session and notwithstanding Rule 22, I ask unanimous consent that the Committee on Health, Education, Labor, and Pension be discharged, and the Senate proceed to the immediate consideration of S. 3697. Further, I ask unanimous consent that the bill be considered, read a third time, and passed, and that the motions to reconsider be considered made and laid upon the table.
Is there objection?
Mr. President, reserving the right to object.
Senator from Maryland.
Let's be clear. This bill would roll back the clock by 25 years. It limits access to a safe and effective medication that has been approved by the FDA since 2000. Hundreds of robust clinical trials have demonstrated mifepristone's safety. That's not political, that's science. This bill would impose new requirements on prescribing healthcare providers, and it would restrict drug dispensing to in-person administration, specifically targeting women living in rural areas and women without access to a primary care doctor or OBGYN. For the past year, we've all watched as Secretary Kennedy and this administration have peddled conspiracy theories and junk science to dismantle public health structures in this country. Just like with the pediatric vaccine schedule, changing the rules on FDA-approved drugs without specific scientific input, legitimate evidence on safety risk or transparency will cause unnecessary fear for patients. This bill undermines the critical role of the FDA in ensuring the safety and efficacy of medical products through a gold standard review and approval process. It overrides the FDA's oversight authority by prematurely banning approval to medications even if they are safe and effective. That's not gold standard science. It's an effort to control women's bodies and their health care decisions. On the very anniversary of the Dobbs ruling, Senate Republicans are looking to continue to restrict access to care. I want to remind my colleagues that mothers living in states with abortion bans are nearly twice as likely to die during pregnancy or childbirth compared to those in states that allow women to access reproductive care. These tragedies happen when there are delays in miscarriage and emergency because reproductive medicine is criminalized. I object to this legislation.
The objection is heard.
Reserving the right to object.
As I just said, on the very anniversary of the Dobbs ruling, Senate Republicans are looking to continue to restrict access to care. In stark contrast, Senate Democrats are working to expand access to health care for women. We're working to better support new and expecting mothers and babies. I introduced the Healthy Mom Act to do just that. Uninsured pregnant women are more likely to miss critical prenatal care. These gaps in care lead to a 31% higher likelihood of adverse hospital and delivery outcomes. My bill would ensure that all women eligible for coverage through Affordable Care Act marketplaces and private insurance can access affordable health coverage throughout their pregnancies by establishing a special enrollment period for expectant mothers. Right now, marriage, divorce, changing jobs, or having a baby are considered qualifying life events that trigger a special enrollment period. But becoming pregnant is not considered a qualified life event. That's unless you live in a state like Maryland, which allows women to enroll in or change their health insurance plan outside of the standard open enrollment period after they learn they're pregnant. If you want to protect moms and babies, you need to make sure that they have health insurance and access to the care they need. I ask unanimous consent to pass this common sense legislation to close a senseless loophole and keep expecting mothers across the country healthy. As if in legislative session, I ask unanimous consent that the Committee on Health, Education, Labor, and Pensions be discharged from further consideration of S3274 and the Senate proceed to its immediate consideration. Further, that the bill be considered read a third time and passed, and the motion to reconsider be considered made and laid upon the table.
Is there objection?
Reserving the right to object, Mr. President, I object. While my colleague's bill seemingly aims to assist expecting mothers with the burdensome cost of pregnancy and childbirth, I would like to point out that this legislative effort is not designed for success and it has zero bipartisan support. However, bipartisan support in this arena is possible, and I'm so grateful to my colleagues on both sides of the aisle who have worked with me on the Supporting Healthy Moms and Babies Act. I introduced this effort last year with Senators Kaine, Gillibrand, and Hawley to insulate expecting parents from the high cost of pregnancy and childbirth by eliminating cost-sharing requirements for prenatal, childbirth, neonatal, perinatal, or postpartum health care. Bringing a child into the world is costly enough without piling on cost-share fees that saddle many mothers and families with debt. The bill would take away some of the burden for childbearing generations. My hope is that if we can relieve the financial stresses associated with pregnancy and childbirth, more families will be encouraged to embrace the beautiful gift and the responsibility that comes with parenthood.
I'm sorry. The objection is heard.
Mr. President.
Turek is the senator from Oklahoma.
Mr. President, is the Senate currently in a quorum call?
We are not.
Thank you, Mr. President. Mr. President, it's towards the end of June. 250 years ago today, Thomas Jefferson was in the third floor of a rented space in Philadelphia, literally by himself, working at a desk that he had built himself, writing a declaration. 250 years ago, literally today, he was by himself writing away on that. Within about 4 days from now, 250 years ago, the committee of five, the four others that work with him, all determined, no, this is the document that we're going to present to the Continental Congress. It's kind of remarkable to be able to think about that kind of history. They determined that they were going to end that simple statement at the introduction to say, we hold these truths to be self-evident, that all men are created equal. They're endowed by their Creator with certain unalienable rights, that among these are life, liberty, and the pursuit of happiness. It was a much debated statement, and they made several different changes to it. But that's still that same statement 250 years later still rings true as a core value of who we are as Americans. Mr. President, today I rise to be able to mark the 4th anniversary, though, of the Dobbs decision, a decision that overturned Roe v. Wade and returned the issue of abortion and when life begins and who we're going to be as a people on this issue of life, liberty, and the pursuit of happiness back to the elected representatives from states and to the people. Today we're remembering 60 million children who died under the 49-year time period under Roe v. Wade, and the conversation that's still happening all over the country. We, the people, are still having a dialogue about the value of every human person and whether life, liberty, and the pursuit of happiness still applies to everyone. Does it apply to only people that are a certain height, a certain weight, a certain age, or does it apply to every single person? I'm one of those crazy people that actually believe that children are valuable, all of them. And I know it's much maligned in our culture currently, and it's very vogue to be able to say some children are valuable and some children are disposable, and children that are disposable we shouldn't even discuss. But honestly, I think we should continue the conversation, the dialogue that's been going on for 250 years to determine, does life, liberty, and the pursuit of happiness apply to all of us? Are all people created equal, or are some people more equal than others? Just because a child cannot defend himself, just because a child doesn't weigh very much yet, doesn't mean it's not a child. Science would say that life begins at conception when the cell division happens. Every single cell in the woman's body has the exact same DNA, except when she's pregnant. Then there are certain cells in the womb that have different DNA. Do you know why? Because it's a different person. And there's cell division happening in the woman's body because she's alive. And there's cell division happening in that child's body because so are they. And they're a uniquely different, God-created person. They're not inconvenient. They're a child. And we're still having this conversation as a country to try to determine what are we going to do about that. So many of my colleagues have come to the floor today on the 4th anniversary of the Dobbs decision and said, let's keep the dialogue going. Let's keep talking about this issue of when a child is a child. Do they have to be a certain weight? Do they have to be a certain age? Do they have to be a certain height? Or is it when basic science would say that child is a child? What's interesting about this, Mr. President, is I'm not even bringing a bill tonight to be able to deal with the issue of abortion of a child. I'm actually bringing a bill tonight to be able to talk about conscience of individual healthcare providers. You see, Mr. President, most doctors and healthcare professionals share a common belief, a science-based belief, that a child in the womb is just like the children they care for outside the womb. The only difference is time. A child at conception and a child outside the womb are no different, it's just 40 weeks older. That's it. I'm 40 weeks older than I was 40 weeks ago. That child is 40 weeks older from conception to birth, but it's still the same child. For the millions of Americans who believe this same truth, we have a conscience protection laws on the books, and we've had them on the books for a long time. In fact, there are 25 federal conscience protection laws right now that are already the law of the United States. Many of these are just flat out not being controversial. Let me give you a couple of them. The church amendments. These laws protect the conscience rights of individuals and entities that object to performing or assisting in the performance of an abortion or a sterilization against their religious or moral convictions. When that passed Congress, right after Roe v. Wade, when that passed Congress, it passed 92-1. It was not controversial. In 2004, when Congress created the Weldon Amendment, which is in all of our annual appropriation bills still, the Weldon Amendment bars the federal government and state and local government recipients of federal funds from discriminating against healthcare entities that refuse to provide, pay for, or provide coverage or to refer for abortions. It wasn't controversial. It passed overwhelmingly. It still continues. The conscience protection bill that I bring tonight is also very straightforward. It's already in federal law that individuals have the right of conscience. The challenge is those individuals only are protected in the right of conscience if the federal government actually goes and prosecutes individuals that violate their conscience. So if the executive branch chooses not to enforce the law, they just ignore it, though it's federally against the law, but no one prosecutes, then nothing happens. And that individual has rights that are actually not protected by their own government. This conscience protection bill is very simple. It says if their rights of conscience have been violated according to federal law, that individual has a private right of action to bring their own suit. If the federal government won't defend their rights under federal law, they have the ability to be able to bring it on their own. This is a very simple, straightforward bill. It doesn't change anything about abortions. We'll have the exact same number of abortions the next day after this passes than it did today. Exactly the same. But what it does is it says to a person that literally it violates their own conscience to be mandated to perform an abortion, but yet their company that they work for is forcing them to be able to carry this out against their own conscience. This allows them to be able to object and to be able to say, someone else here needs to perform this. I should not be required for the fear of my own employment, to be able to take care of living, healthy people or hurting people, that I'm also being required to take the life of a child at the same time when that violates my conscience. So this is a straightforward bill, again, that won't limit abortion at all, but will protect the rights of individuals to have their own rights of conscience. So as if in legislative session, notwithstanding Rule 22, tonight I ask unanimous consent that the Committee on Health, Education, Labor, and Pension be discharged and the Senate proceed to the immediate consideration of S1756. Further, I ask unanimous consent that the bill be considered read a third time and passed, and that the motions to reconsider be considered made and laid upon the table.
Is there an objection?
Reserving the right to object.
Senator from Oregon.
Thank you, Mr. President. Mr. President, I rise to object to this bill, which would restrict access to vital health care coverage and make health care more expensive for many Americans. 13 states, including my home state of Oregon, have passed laws that require insurance companies to cover reproductive care, including abortion services. If this became law, this proposal would override those state laws. It would let insurance providers deny women coverage for care they need. Women should make their own health care decisions, not politicians, not state governments, and certainly not insurance companies. For all of these reasons, I object. Mr. President, I rise now to offer my legislation with Senators Tina Smith and Patty Murray to restore funding for Planned Parenthood. That funding was gutted under the Republicans' budget bill passed nearly a year ago. In that time, 23 Planned Parenthood clinics have closed. 75% of those were in rural or underserved areas. Breast cancer exams fell by 25%. Planned Parenthood, unfortunately, has become a scapegoat for many Republicans. In reality, these clinics provide life-saving primary care. They provide cancer screenings, annual exams, testing. The majority of these clinics serve areas where there's already a shortage of providers. The fact is, they are a lifeline for rural America. As our country faces a nationwide healthcare provider shortage, this body should be doing everything in its power to expand access to care and bring down costs. Instead, many Republicans remain laser-focused on forcing their agenda on the American people, an agenda that results in closed clinic doors, fewer providers, and higher costs. The legislation that I now offer this evening would restore funding for Planned Parenthood clinics. It would restore life-saving health care for millions of women, especially those living in rural areas and healthcare deserts. Therefore, as if in legislative session, I ask unanimous consent that the Committee on Finance be discharged from further consideration of S-2524 and the Senate proceed to its immediate consideration. Further, that the bill be considered read a third time and passed, and that the motion to reconsider be considered made and laid upon the table.
Is there objection?
Mr. President, reserving the right to object.
Chair recognizes the senator from Oklahoma.
Mr. President, I actually brought a bill tonight to be able to protect the conscience rights of individual healthcare workers. It doesn't change the number of abortions in America. It doesn't raise insurance costs. It doesn't do anything else. It just says to a nurse that doesn't want to perform abortions that her hospital can't compel her to be able to perform abortions. That seems like a pretty reasonable bill. Obviously, my colleague disagrees on that, but he wants to instead bring a bill that dramatically could increase the number of abortions in America. There used to be a time when we used to talk about abortion being safe, legal, and rare. That doesn't even seem to be the conversation anymore. It's just how do we get more? Planned Parenthood did almost 500,000 abortions alone. And I know there's a lot of conversation saying they do health screenings and such. They're most known for doing abortions, about 500,000 of them. Planned Parenthood does 2 abortions a minute across the United States. A minute. The problem is this Planned Parenthood entity that has $2 billion in income and nearly $2.5 billion in assets is also one that has faced very serious allegations. One of the most recent serious allegations came from the far-right newspaper, the New York Times. The New York Times, which is not exactly known for being a right-leaning periodical, did an extensive article outlining the problems with Planned Parenthood all across the country. Let me just read to this body part of what the New York Times printed about Planned Parenthood. They talked about the botched abortions that they've done in New York and the scores of allegations that the New York Times reviewed and the times that they said the Planned Parenthood gave poor care, their quote. Here's another quote from them. In a case settled in California last year, a woman accused the organization of improperly implanting a birth control device in her arm and causing nerve damage. A Nebraska clinician in 2022 didn't realize that a woman was 4 months pregnant when she inserted an IUD. Several hours later, the patient was rushed to an emergency room and gave birth to a stillborn child, fetus, they listed. For months last year, the North Central States affiliate, which oversees the Nebraska clinic, an understaffed nursing department, did not upload sexually transmitted infection test results into charts, and patients wrongly believed their results were negative when they didn't hear back. Not only is Planned Parenthood doing 500,000 abortions, even according to the New York Times, the testing that they're doing and the other work that they're doing, they're botching. This is how they listed the Omaha Planned Parenthood clinic. Sewage from a backed-up toilet seeped into the abortion recovery room for 2 days, according to interviews with staff members and photographs and text messages shared with the New York Times. Employees shoved exam table pads under the bathroom door to block the leak, and patients vomited from the stench. Sewage seeped under the door at the Planned Parenthood facility in Omaha all last year. Clinic workers complained that they were learning from inexperienced peers. More than a dozen said they did not receive adequate training for patient intake, blood draws, or other tasks. They go on and on and on. It's a very long article that the New York Times laid in there and talked about how that wealthy donors have stepped in to be able to help fill the gap, but that Planned Parenthood is not using that actually for health care. Planned Parenthood is using the money that's donated to them for their political operation, not patient care. So when my colleague says that Republicans don't want to provide funding to Planned Parenthood, it's true. Because of not only their medical records and for what's happening all around the country in these locations, but this has become a political operation more than a healthcare operation. We have a lot of great federally qualified health centers all around the country that are doing a terrific job taking care of families and women in many places, but they're not specializing in abortion. Planned Parenthood is focused on abortion. And even according to the New York Times, they're not even doing a good job with that. So yes, I do oppose this, and I do object to providing more money for an entity that is not taking care of even what it's already doing and is focused on taking the life of children, not protecting the lives of families. I object.
Objection is heard. As Senator from Utah.
President, almost 250 years ago, 56 delegates to the Second Continental Congress affixed their signature to the most influential document in the history of human rights, the American Declaration of Independence. Over succeeding generations, more than 100 other nations would model their own Declaration of Independence with statements that followed the American pattern of 1776. It proclaimed liberty as an inalienable right in what Walter Isaacson has called the greatest sentence ever written. Among our inalienable rights, the document declared our life, liberty, and the pursuit of happiness. Defining liberty, giving definition, substance, and legal guarantees of that right has been one of America's greatest ongoing commitments to the betterment of humanity. And at the forefront of that pantheon of liberties, the Declaration affirms, has been the right to believe and practice religion according to the dictates of our own conscience. 4 decades ago, 160 of 170 international constitutions were modeled in whole or in part on the American model. Freedom of religion is guaranteed in principle, if not in fact, in 97% of those constitutions. When the first colonists arrived in the New World, religious freedom existed in theory, like that of John Locke, but not in political practice. Roger Williams founded Rhode Island on the principle of sole conscience in 1636. And 150 years later, in 1786, Thomas Jefferson authored the pioneering Virginia Statute of Religious Freedom. Almighty God hath created the mind free, he wrote, and manifest his supreme will that free it shall remain. The state legislation he proposed therefore decreed that no person shall suffer on account of his religious opinions or beliefs, but all persons shall be free to profess their opinion in matters of religion. It was a long journey from Jamestown to Plymouth Rock to that Virginia statute, the U.S. Constitution, and the Bill of Rights. America has made great progress, but the road has been at times harrowing for those people at the margins of our mainstream. Quakers were hanged in Massachusetts in 1659. Baptists were imprisoned in Virginia in the 1770s. Catholic convents and schools were burned in 1834. And my own people, the Latter-day Saints, were mobbed and murdered in Missouri and Illinois in the decade to follow. And Jewish people have been the victims of discrimination and violence from the founding to the present. One of the lessons to be learned from this history is that you can legislate religious protections, but you cannot legislate respect or compassion or bonds of charity. Yet religious freedom hinges on these virtues. Our public discourse, however, has never tipped so precariously into what Arthur Brooks has called a culture of contempt. If you think you sense something alarming in the air, the statistics say you're right. A March 2026 Pew survey reveals the distressing fact that Americans view their fellow Americans with more hostility and suspicion than is the case in any democracy surveyed. The United States is the only place surveyed where more adults describe the morality and ethics of others living in the country as bad, 53%, than as good, 47%. We can do better. We have to do better. Yes, as members of this national community, we have the right to espouse our values, religious, moral, or political, without hindrance or constraint. That also means we must accord to others the right to espouse their values without hindrance or constraint. Religious freedom is distinctly entwined with pluralism because the free exercise of religion presupposes a mosaic of different values and other life orientations. The words kindness, civility, and charity nowhere appear in our Constitution or our Declaration of Independence, whose anniversary we will commemorate next week. That is because those values were presupposed by the founders. This grand experiment in democracy required for its organization and requires for its continuation a willingness to build bridges of understanding as well as defend principles to which we are committed. Dr. Matthew Holland has written of how civic charity and deeply embedded in our thoughts. John Winthrop, leader of the Massachusetts Bay Colony, of Thomas Jefferson, America's apostle of religious liberty, and of Abraham Lincoln, who so powerfully invoked the better angels of our nature at a time of national crisis. We will never achieve consensus on the particulars of our religious commitments or our lack of religious commitments, nor should we. Our pluralism is a source of our strength and should be a source of pride. However, we can honor our founding principles by returning to a particular kind of faith they did have in common. Faith in the essential goodness of each other and one another. The psychologist Jamel Zaki has written, "Cynicism is a lack of faith in people. Skepticism is the lack of faith in our assumptions. Charity is the only way whereby we flourish in our differences, even as we work together for a more perfect union." Thank you, Mr. President.
Mr. President.
Chirkness, Senator from Virginia.
Thank you, Mr. President. In a few minutes, we will move into a series of votes, and one of the votes is a motion to proceed to a resolution that I filed a number of weeks back, an Iran war powers resolution. The current status of that resolution is about a month ago, we successfully discharged it from the committee, and so it is now able to be called up on a motion to proceed. I want to just inform all of my colleagues that while I'm always going to vote for a motion to proceed to my resolution, the resolution is completely superfluous. It's completely superfluous because both houses of Congress have now taken the historic step of voting for the first time under the history of the War Powers Resolution that the President of the United States cannot restart a war legally unless he asks Congress for permission. That's left the station. Both houses, Republican majority, have said it will be illegal for Donald Trump to start back the war against Iran without a vote of Congress. And so any action on the motion to proceed to my resolution is superfluous because that vote is done, Congress has spoken, and the will of both houses is now clear. So I will vote to proceed to my motion, but no one else should feel any stress about this one. Congress has clearly spoken and rebuked the president for starting an illegal war and saying he can't restart it without us. And with that, Mr. President, I yield the floor.
Senator from Vermont.
Thank you. Mr. President, in the United States today, 42 million Americans are drowning in $1.7 trillion in student debt. 42 million Americans, $1.7 trillion in student debt. Further, a record-breaking 9 million Americans are now in default on their student loans. Instead of providing financial relief to these Americans, the Trump administration is about to make a bad situation even worse. As we all know, President Trump's so-called big, beautiful bill, to my mind, the worst piece of legislation passed in modern history, made the largest cut to education in the history of the United States in order to pay for the largest tax breaks for billionaires in American history. Not only did we throw 15 million people off the health care they had, we devastated federal funding to education. If Congress allows these education cuts to take effect, beginning on July 1st, just 6 days from now, 7 million Americans will be thrown off of their low-cost student loan repayment plan, known as the SAVE plan, and into a much more expensive plan. What does that mean in real terms? It means that the average college graduate will be forced to pay $4,000 more each year on their student loan payments, about $244 a month. Mr. President, at a time when tens of millions of Americans, working-class Americans, are struggling to pay for the outrageous cost of housing, groceries, prescription drugs, health care, and other basic necessities, the last thing in the world we should be doing is driving up the cost of student loans by $4,000 for the average student loan borrower in America. It has been estimated that if these cuts go into effect, 1 out of every 4 student loan borrowers will be in default by the end of this summer. So what does it mean to be in default? It means that workers could have their wages garnished to pay back their student loans. They can't pay their student loans because they're not earning enough money, and then they get their wages garnished, and they'll be in an even worse situation. It means that seniors who took out student loans for themselves, and I know many people don't appreciate it. You think about student loans, you're thinking about young people. Well, guess what? There are grandparents who are still paying off their student loans. And it means that for these people or their family members could have their Social Security checks garnished. Imagine going to college, paying off a student debt for 30 or 40 years, and you can't continue to do it. They're going to take your Social Security payment. In my view, that is unconscionable. We cannot allow that to happen. And that is why I'm very proud to co-sponsor Senate Joint Resolution 196 that we will be voting on this evening. And I want to thank Senator Merkley for his outstanding work on this issue. This resolution would ensure that millions of Americans are not forced to pay thousands of dollars more each year on their student loans. 2 weeks ago, I held a roundtable with 4 student loan borrowers from across the country who shared their stories about the struggles they are having with student loan debt. I spoke with a gentleman named Jordan from my own state of Vermont, who is a veteran and a father of 2 young boys. He was told that his student loan payment will increase to $1,300 per month after July 1st. And other members who talked with me had very similar stories. Geraldine, who is 71 years of age, has student loan debt from when she went to college in the 1980s. And decades later, she is still struggling with student loan debt. Geraldine is retired and on a fixed income, and she was told her payments will be over $500 per month after July 1st. And on it goes. Mr. President, if Congress does not pass this resolution today, working-class people all across this country will be priced out of necessary graduate training in programs like nursing, medicine, dentistry, and social work because of new restrictive arbitrary loan limits. What this means is that working-class students will either be unable to get the education they need or that they will be forced to take out loans from predatory lenders that charge interest rates as high as 26%. Now, at a time when we desperately need nurses and other healthcare professionals, how insane is it to force students to pay interest rates as high as 26% in order to do the important work we desperately need? Mr. President, at a time when we have a shortage of nurses, doctors, and dentists in this country, it has been estimated that 21% of nursing students, more than half of medical students, and 3/4 of dental students will be priced out of a degree altogether. In my own state of Vermont, 40% of students pursuing graduate education will exceed the new loan limits and be forced to resort to private loans to make up the difference. In the richest country in the history of the world, no one should be saddled with a lifetime of debt for the crime of getting an education. No American should enter retirement with the burden of student loan debt or be pushed into default because they can't afford their payments. So, Mr. President, let us prevent student loan payments from going up by an average of $4,000 for 7 million Americans. Let us prevent working-class students from being priced out of pursuing degrees in nursing, medicine, and dentistry. I urge my colleagues to vote yes on this resolution.
Chair recognizes Senator from Oregon.
Mr. President, I asked, are we in a quorum call?
We are not.
I ask unanimous consent to grant floor privileges to my interns for their shadow days on the following dates. Anjuli Virensinghe on July 15th, 2026, and Kaine Deo on August 5th, 2026.
Without objection.
Thank you very much, Mr. President. And I'm going to make a few remarks now about the Congressional Review Act vote we'll be taking later tonight. And here is the thing. This is so straightforward in terms of here in the United States of America, pursuit of an education to serve the people of this country should never be a privilege reserved only for the wealthiest Americans. Indeed, don't we want every child to have the opportunity to thrive, to get a graduate degree, to get a professional degree, to be able to serve in the many capacities where we're desperately short of individuals? Of course we do. And this is something very near and dear to my heart because I'm a blue-collar kid. And my father said when I was in grade school, you go to the doors of the schoolhouse, you go through those doors and you study hard, and you can do just about anything in America because we're so fortunate to live in America. That's a beautiful idea, that every child has the opportunity to pursue their dreams, and if that requires a college education, to be able to pay for college education without a millstone of debt around their neck, or just the actual impossibilities of having access to enough funds to pay tuition. So I pursued that vision, and my interest did take me to college, and I did borrow money, and I did get scholarship, and I did wash dishes year after year in order to help get through. But that journey is becoming so much harder now when college is so much more expensive. When I got out of high school, if you worked a minimum wage job the summer of 1974 at $3 an hour, you could save enough money living at home to pay the tuition for a public university in my home state of Oregon. Or you might still have to work in order to, well, have a room to live in and have food to eat, but you could pay the tuition. And now it's completely out of sync. You cannot save enough on minimum wage, which is still only, in many states, only $7.50 or half that if you have a job that has tips in many states. No way you can pay your tuition. And so, shouldn't we all be working to make it easier for children to actually get the expertise that we need in our services, in our economy? But, indeed, we're going the other direction. I have often spoken about how I feel the big, beautiful bill, as Trump called it, hurt Americans along the way, kicking millions of Americans off health insurance and gutting nutrition and slashing funding for higher education. Why? But now we have something else, which is a rule from the Trump administration that will make it very hard for ordinary children coming from modest means, families of modest means, or very restricted income to be able to go on to college and to go to graduate school. In fact, that bill, that big, beautiful bill, as Trump called it, eliminated the Grad Plus loans, which allows students to borrow the full amount of their program, and replaced those loans with two categories. A graduate degree student is limited to borrowing $20,500 a year, and up to $100,000 in total. So that restriction, a graduate degree student, who does that apply to? Well, it applies to nurses, to social workers, to physicians' associates, to teachers, to engineers, to physical therapists, and many other categories. And so those professions are told you can only borrow $20,000, $500 a year, $20,500 a year. So what does that mean? It means that since tuition is often much higher than $20,500, and then throw in the dormitory and throw in the food, well, you're talking $40,000 a year. There's a survey from the American Association Colleges of Nursing, which reports the average cost of a nursing program, $38,500 a year, the average cost, so often over $40,000. So what is the effect of putting this limit of $20,000, $500? Well, this is a gift to the predatory lenders. Now, one friend of my son's, well, she had 6% loans that were the government loans, and then she had to get private loans. What was the interest rate on that? It was 11%. We are basically saying, hey, if you are wealthy and your parents can pay your tuition and your dormitory and your food, hey, you're golden. The avenue of opportunity is for you. But if you are from a family that doesn't have the ability to pay that cash and you have to borrow, we're going to force you to borrow loans that are 9, 10, 11, 12%, because we don't want that avenue of opportunity for you. We only want it for the rich kids. This is a rule for rich America, and this is a penalty against normal people. That's wrong. I thought this democracy was supposed to be of, by, and for the people, not special gold-plated avenues for the kids of the richest families. And I know that this chamber is full of multimillionaires, maybe a few billionaires, who don't know the darndest thing about how families struggle across this nation and how much they want their kids to have opportunity too. So this is very simple. Let's reject this rule that puts up a huge barrier for the children of families of modest means and medium income or low incomes. Let's knock down that barrier. Let's not force them into predatory lending. Now, there are some who say, but wait. We think that the schools will lower their tuition as a result of us making loans unavailable. That's a false premise. Never worked anywhere, because the schools have to pay the professors. They have to pay for the infrastructure. They have to pay interest on the buildings they've already built. And so they have to charge accordingly. When we saw before, and we've been down this road, when there was the limit on public loans and people had to go to private loans, like the friend of my son, you end up with those 10, 11, 12% interest loans. They're predatory against our children of the next generation. So who here wants to speak up for the rich to be the only ones with opportunity in this country? Let's strike down this rule and say to the president's team, when this bill was passed, no one in this chamber meant to say that opportunity is only for the wealthy kids. This is our opportunity. It's a Congressional Review Act. It means we can say no to a rule that puts up a hurdle to ordinary children. So it isn't as if everything is rosy for the children of the next generation. Hey, housing prices up through the roof. Home ownership median age has risen from 33 to age 40 over just a 5-year period because the next generation can't afford to buy a home. Rents are pressing people against the wall. Tariffs have added so much cost to the families. Why are we going to pile this predatory loan program on top of everything else? It's absolutely wrong. So let's just join together and say, let's put this rule in the rubbish bin. Let's put it through the shredder, because it only hurts the next generation that we should be striving to help thrive. Thank you, Mr. President.
It was saddling students with student loan debt, forcing them to live in their parents' basement because they couldn't pay back those loans. And if you looked at the people taking these loans, they may not have completed their degree, or the degree they got paid them less than a year than the annual tuition they were forced to pay. And of course, that tuition, paid for by borrowed federal money, compounded interest, leaving them mired in debt. It is a false compassion to say that every person should be able to borrow as much as they want from the federal government to go to the school, whatever the school charges. That is a false compassion. Republicans are not about false compassion. We're about allowing Americans to live the American dream. But that is not by saddling them with debt like a weight around their neck, pulling them into a pool of debt from which their whole life is affected. Mr. President, it's pretty clear. The cost of higher education is out of control. And that is, in part, because of federal lending programs that would allow students to borrow whatever they wanted to, almost, and so universities raise their tuition to maximize income. Not to maximize value, but to maximize income. By the way, a 2023 National Bureau of Economic Research study found that uncapped federal borrowing for graduate programs did not increase access or degree attainment. Think about this. Oh, we can get much, much, much more money, but the NBER found that giving as much money as they wanted did not increase access and did not increase degree attainment. You know what it did increase? Student loan debt. That's what it increased, because the universities making profit off of that really ultimately were not left holding the bag. It was the student and the U.S. taxpayer who were left holding the bag. Colleges could increase their prices. The higher the cost, the bigger the loan. The kid drops out, doesn't graduate, can't pay back the loan, taxpayer picks it up, person saddled with debt, but the college has the money. Now, by the way, putting Americans more and more in debt while colleges raise tuition only makes the affordability crisis worse. In August, Republicans put an end to the nonsense, and we passed the Working Families Tax Cuts bill. We addressed the root cause of rising costs. We put limits on federal loans for professional degrees. As a result, there's universities already lowering their costs. Last fall, Santa Clara University cut law school tuition by $16,000, citing loan limits the Senate Republicans enacted as a catalyst. Think about that. Law school is 3 years, 3 times 16. We got $48,000 less in borrowing in a response to the legislation that we passed. UC Irvine recently announced cutting tuition for their MBA program by 38% for the upcoming fall semester. Now, unfortunately, the resolution offered by my friend from Oregon undermines this success. And the claim is that this merely corrects a rule put forward by the Trump administration that limits access to taxpayer-funded loans for certain professions. That's not true. This resolution would nullify the Department of Education's regulation for implementing all student loan reforms enacted in the reconciliation as part of the Working Families Tax Cuts bill. Every part of it is going to be nullified. A vote for this CRA undermines the $284 billion in savings for the U.S. taxpayer. A vote for this CRA is a vote to undermine changes that are already reducing the cost of higher education. A vote for this is a vote to allow the student to borrow as much as she wants to in response to a tuition skyrocketing and to land her into a hell of student loan debt that she can never escape. A vote for this is to go back to the Biden approach to student loans rather than the historic reforms passed by congressional Republicans and signed into law by President Trump. Now, by the way, there's a nuance here. If you're thinking about voting for this resolution because you have concerns about how professional degrees have been defined in the rule, we should talk. I am happy to have that because, frankly, I have some concerns about that. And so let's see if we can actually address that in an appropriate way, not in a blunt axe way. That debate is a separate, targeted conversation not fit for an overly broad CRA. For example, let's address the criticism that nurses and social workers are excluded from professional degrees. Now, I'm going to be clear. I'm a doc. I worked with nurses. They are professionals. They right up there with me because I've been at 3 in the morning taking care of sick patients vomiting blood. I know the professionalism that nurses bring to their care. Similarly for social workers. So no one doubts that they are professionals. No one doubts that they are essential to the health system. But this debate is a debate about certain degrees that are required for entrance into the profession and require longer lengths of study than graduate level programs. And based on those factors, should you be able to borrow up to $200,000 in taxpayer-backed federal loan programs to pay for a degree? More importantly, do you have a realistic ability to pay back that loan? If someone does not have a realistic ability to pay back the loan, then the university should not be charging that much. By the way, most nursing students, 95% of them, borrow less than $100,000 to complete their degree. That's below the borrowing limit Congress established in the Working Families Tax Cut. The 5% of nursing students borrowing more than $100,000 choose to take on that debt. They choose a more expensive option. Clearly, since 95% don't need to borrow that much, there are other options, and not all nurses need federally backed loans up to $200,000 in order to get their degree. So, is my colleague suggesting that taxpayers subsidize the 5% of nursing students, regardless of their ability to pay back the loan? I don't think that's fair to them. If there are a limited number, and this is important, if there's a limited number of targeted subspecialties of professionals, I think of as CRNA, that are inadvertently and inappropriately excluded by this rule, let's have a conversation. Let's measure their ability to pay back such a large loan, and if that loan and the degree it pays for is necessary for their professional subspecialty, and importantly, can they pay it back? CRNAs do well. I personally think we should have a higher loan limit for them, as one example, because they're going to do well financially. And to the point, it can be more expensive for them to have their training. That's, if you will, a nuanced approach looking at a group of people for which we know the facts. But that's not what this CRA does. It guts all reforms and sends us back to the Biden administration's student loan disaster. Mr. President, there are bipartisan efforts on my committee to make college more affordable for students, families, and taxpayers. I'm leading the College Transparency Act, CTA, which allows students to compare the differences between a college they may go to and the major within that college to see the value of the degree relative to the price of admission. I ask my Democratic colleagues to work with us to advance these bipartisan solutions, not push partisan resolutions that raise the cost of college and bury students with debt. I urge my colleagues to oppose this effort.
Mr. President.
Senator Morgan.
Would my colleague yield to a question? Yes, sir. I believe I understood you to say that you were citing a university that has lowered its tuition. Did I understand that correctly?
Correct.
And which university was that?
I think it was Santa Clara. I have to go back to my notes. I think it was Santa Clara.
Santa Clara. Is that a private or a public school?
I'd have to, I don't know if the University of Santa Clara is private or public.
So here's the thing. There's 4,000 universities in the country. Do you have any idea how many have followed that example and lowered their tuition?
I don't know how many have, but the bill has just passed. And I do know that market reforms permeate society. And as a student realizes I can go to the community college down the street and get a nursing degree and pay for it entirely with a small amount of money, or I can go someplace far more expensive and have to borrow $100,000, or in the case of the previous law, $200,000, that market forces, and particularly if we put in the College Transparency Act, will have that individual go to one where they get the better value for their education. That I'm positive of.
My colleague is not completely wrong. There are less expensive ways to get a nursing degree. Indeed, my wife is a nurse, and she got her 2-year nursing degree at a community college. And that we were very, very fortunate to get even some scholarship to help her do that at a time when our income was extremely little. But here's the thing. There aren't very many slots like that. And the 4-year programs that are throughout Oregon at private universities, you can't come close to paying your annual expenses at $20,500. Now, we need a lot more nursing slots because there's a lot of folks coming out of high school, straight A's. They can do the statistics and they can do all the prerequisites, but there just aren't enough slots. So we're wrestling with the fact that we're importing a lot of nurses from overseas rather than opportunity for our kids. What this means is, yes, you are right, there are some ways to get a nursing degree, a 2-year degree in particular, that is less, but most folks either have to do another 2 years because now hospitals won't take a 2-year nurse. They have to go often to a private program, and those programs average $38,500 a year. And the math is simple. For the families like the family I come from, where you have to borrow, borrowing at 6% is a hell of a lot better than borrowing at 11%. So the rich, their families have home equity loans. They can even borrow, if they're going to borrow, they borrow at 6. So we're saying here is this big obstacle for ordinary people who don't have parents who are affluent. It's just the math. And the idea that all those programs are going to be labeled to lower their $38,500 on average, many are much more, to $20,500 is just false. There may be 1 or 2 universities that have lowered it, and by the way, they did it in anticipation, and maybe for different reasons, because this hasn't come into effect yet. It's coming into effect a few days from now. That's why we're talking about this now. It is going to affect folks going to school next year. So this is very disturbing to me that we are creating this obstacle for families who need help. Thank you, Mr. President.